things that I personally don't like about my nose is I've always felt that it was too big, sticks out a little too far, and there's a bit of a bump. I feel like there's a little bit of a bulb, not too much of a fine tip, but a little bit smaller. I've never really liked my nostrils. I felt they were a little too wide, and so he's going to be correcting that as well.
We went over a plan for Juliana, which involved just smoothing down a small bump and reducing the tip and also pulling the nostrils in, so the nose would just overall have a thinner appearance, something that fits her face better, has a better proportion of their face, a more feminine look.
I think it's going to have a pretty big impact in my life. Like, first of all, when I see pictures of myself, I'm going to be happy with looking at my nose in the pictures, because that's one thing now that bothers me a little bit when I see my pictures. I look at my nose first thing and then see the imperfections in it. The nose is like the centerpiece of your face, and it's a noticeable thing, and so I feel that it's going to help me in that sense.
Most patients probably don't have nostril work done, but in her case, she felt that her nostrils were just too wide, showing up on her photos too wide. So we added the nostril procedure, which adds a little scar on the corner of the nostril, but it's very hard to see.
I know that Dr. Kim's going to do a wonderful job, and I mean, that's, I think, what's keeping me, happy and encouraged. And yeah, so I'm just excited. I'm ready to go in and come out with a new nose.
So today we're doing a rhinoplasty, and we're going to be removing a small bump, reducing the tip, and bringing the width of the nostrils in. The main issues are the bump itself and the width of the nose. So when we break the bones and reduce the bump, pull the nostrils, I think she'll have a nice narrower looking nose without that bump, and she'll have a great result.
Extremely happy with my results. He did exactly what I wanted, and I couldn't have gone to a better doctor. He listens to you, and like I said, he did exactly what I wanted. So it's been over a year now, and the nose is pretty much healed, so it's not going to change too much. So these are pretty much the final results. After the procedure, you have to come back and see Dr. Kim again for all your follow-up visits, and it's just so simple. You just walk in, the staff greets you, you sign in, you go in, you see the doctor, and Dr. Kim looks at everything, makes sure that everything is healing well, and asks you if you have any concerns or questions. He's very thorough, he answers everything you need to know. Her nose feels nice and soft, skin is shrunken nicely. Julianne had a little bit thicker skin, so there's a limit on how small the tip would actually get, but it's reduced nicely, the nostrils have come in nice, and she has a much more feminine look to her nose. I would definitely refer Dr. Kim to my friends, my family. I actually already have. They've come to me, they're like, who did your work? I really could do, does he do this? Does he do that? And I'm like, yeah. And I tell him, I definitely recommend him 100%. After a year, it's pretty safe to say that there aren't going to be too many more changes. So once you get about a year out, it's safe to say that those are pretty much the final results that we're going to see. I feel a lot more confident now. I feel like when I walk into a room, before it was like, oh, everybody's gonna look at my big nose, and now it's like, no, there's other things to see. I'm not just the nose, but I mean, maybe that's not what they saw, but that's at least what I felt, And so now when I take a lot of pictures for print work and modeling, and like I always hated just seeing my nose, and now I don't even worry about that. I'm like, oh, I could do a little angle shot, and I get to see like my nose and the pictures, and it's not a distraction to me. And I'm really happy.